Welcome back. I'm Ruth Ann, and this is For Those Who Care. Today, we're going to be talking about home health. There are a lot of misconceptions about home health and just things that people really don't know about it. So, I have my friend Sharon here to talk about it. She worked many years in home health and she is an RN. Sharon, thank you so much for being here.
You're welcome. Nice to be here.
Well, can you start off by explaining what home health is, who it's typically designed to help, and what kinds of conditions or situations would make someone a good candidate for home health?
So, home health is also called home health care, and it's a medical care provided by clinicians in your own home to help you manage a chronic condition or recovery from injury, illness, surgery, or hospitalization. Home health services can be provided wherever you call home, even if you're in an assisted living facility.
So, what types of services are provided through home health care?
Yeah, there's quite a few actually. Skilled nursing being a primary one. There's also physical therapy, occupational therapy, there's speech therapy, medical social work. There's also like IV and nutritional support. There's medication management support, patient and family caregiver education, and wound care. So there's quite a few facets that are involved in home health care.
So, how does home health care differ from other options like hospice or in home caregiving by family or aides?
Home health care is a short-term service with the goal of assisting people to improve their health through skilled managed care, whether it be education and or therapy. It has to be an order from a physician. A scenario would be a person who had an acute episode of hyperglycemia and ended up in the hospital. They received orders for a change in medications, and so the physician would order skilled nursing visits to assist the patient in managing these new medications with their new regimen. It would also include education on managing the diabetes in daily life. You'll find sometimes the reason why they had the hypoglycemia might be not just from medication mismanagement. It could be from a dietary reason, and the family has not realized that this caused the hyperglycemic, which is a high blood sugar level, to cause them to have a failure and ending up in the hospital. So there's obviously education that needs to take place, and then this is when this happens. Or if a person's had a surgery and that's resulted in weakness, and they would benefit from physical therapy, the physician would order physical therapy. If a person also had a change in condition that requires use of adaptive equipment or skill to get around their home, the physician would order occupational therapy. If Also, I've seen it where people have required IV antibiotics for like an infection that's just being stubborn, and but they're fine. They don't need to stay in the hospital, but they're needing this course of antibiotics, like it's for 10 days typically. And so they will send them home, and then the skilled nursing will come in and get them all hooked up and show them how to do it. Sometimes they can do it themselves, and they just need people, a nurse to go in and check on things, make sure that they're doing okay and they know what they're doing. So I think it's pretty cool that they've advanced in this direction to enable people to stay in their homes and have medical care without having to stay in the hospital. Also, the speech therapy, typically I've seen it when a scenario would be where someone's had a stroke and is now having learning disabilities from it. They can be recovering, but there's exercises and therapy that's needed to help strengthen. And a lot of it's like neurological, so that there are specialists that can come and help people with speech and then also help the caregiver with encouraging speech. It might also be a swallowing issue, and because of the stroke, and so they need therapy on knowing how to, more of an education on knowing how to swallow and safely consume food and nutrition and liquids so that they don't cause, harm to themselves and end up back in the hospital for whatever reason. So this service differs from hospice and home care. Hospice is for people with a terminal illness of which there's no cure and the life expectancy 6 months or less. And then home health is in-care service is to assist people with activities of daily living, such as bathing, cleaning the home, that kind of doing like light housekeeping like duties. So that's where it differs from those other two services available, but still in the home.
We used home health care for Lance for the last 10 years of his life, and we used all of those services that you just mentioned for various reasons. But I'm curious, I know that a lot of people don't know about home health and they don't know how to go about getting it. So, what is the process for starting home health care? And how does someone get referred? And what should they expect during the initial assessment or home visit?
Yeah, for home health care, to be covered by insurance, whether it's through Medicare or private insurance, a physician has to order the service, and a person is also required to meet certain criteria to qualify for services. They need to be considered homebound, and that doesn't mean that they're literally non-mobile or can't get out of their home. They have to show that it requires considerable physical exertion and causes taxation. They may need assistance from others to leave the home, like someone to drive them, someone to assist to get to the car. It might need, it might mean that they need to use a walker or a wheelchair. They might be able to walk just fine, but they're on oxygen dependent. And so they can take so many steps or walk so far, and then they've got exertion and taxation. So there's a few ways. It literally doesn't mean you can't get up out of bed and you can't move. It just has to show that there's considerable exertion, taxation, and the requirement of some assistance and to meet that criteria.
And I don't think in all cases that a doctor just recommends home health. So, how would a patient or a caregiver advocate for the the person who needs home health services? What would they ask their doctor?
No, that's a good question, though. As if you're seeing that a need is required, then there's no harm in asking. Say, okay, I need my husband is having speech problems. What resources are there available? So you can put it to the doctor, obviously, to say, I need physical therapy, but I don't have the ways to get to the physical therapist every week. What is there available? I need help managing my medications. I've got so many here, I don't know what to do. Well, that's when a skilled nurse can come into the home and go over the medications, educate, also teach them about um, pill boxes to be able to medisets is what we call them, to how to arrange their medication so that they can keep them in order and safely take them. So it's basically just putting it to the doctor. This is what you need. What is there available in the community to help? And then that might come to the forefront of what's available.
How do the home health professionals coordinate with the patient's doctors or specialists to ensure that the care plan meets the patient's needs?
So the home health care agency will have received an order from the physician requesting a certain service along with the medical records. defining the reason for the service. And that enables the agency, which would be a skilled nurse, to go into the home and one, make sure that they meet the criteria, and two, come up with a care plan that meets the needs of what the doctor has specified. And then the doctor has to sign off of that care plan. So that way, we're not doing something that the doctors just doesn't agree with. And then we can proceed from there on. We can't do it without with that plan of care being signed off.
What are some of the biggest benefits of receiving that in-home health care? And are there any challenges that family members should be aware of?
The biggest benefit to me is being in the comfort of your own home. It helps to have people who are supporting you close by. And if you have a good support, it's a great resource. I think the challenge would be is if you live by yourself or the person you live with is unable to take care of you during your recovery. So then you may be looking at an assisted living facility for a short-term stay, or even a skilled nursing facility might be more suitable. So there's different factors to look at, but great if you've got support, not so much if you don't. If you're trying to recover by yourself, that's comes with its challenges.
And I will say, on the caregiver side of it, home health was a lifesaver for me because Lance had so many appointments, and being able to see the physical therapist, occupational therapist, speech therapist in our home and not have to go out for those weekly or sometimes twice weekly appointments. I mean, there were times when he would have an appointment every single day, and it would
Mhm.
just been impossible for me to take him down to the hospital every day for those appointments.
Well, to me, it's like, how does a person recover if they're having to go out of the home and spend all their energy getting to and from these appointments? To me, it's kind of like defeats the purpose of the reason for the therapy. Yeah, you kind of taking two steps backwards and one foot forward in my books. So I think it's a great program.
Well, I would agree with that. Can you tell me, how does home health support family caregivers?
The main focus is on education and assist on road to recovery, so it definitely involves family and caregivers. If a person has had a change in condition regarding, say, for instance, their heart, that's causing an increase in fluid in their feet, the caregiver would benefit on nutritional education, what kind of foods can cause that swelling, what would be a good alternative. Um, going over their going over the medications, letting them know this is what they're taken for. Like I've seen it where someone's been given a diuretic, like a water pill, and they're like, "Oh my gosh!" I've literally gone into the home and they've like, "I've been up all night long trying to going to the bathroom all night. This is ridiculous." And I'm like. So one of my first things is like, are you on a water pill? Like, yes. I'm like, what time do you take it? Oh, around dinner time. And then they want to know why they're up all night. So your education piece would be, well, let's take it when you first get up in the morning. And then you've got the day to go to the bathroom. And then at nighttime, it should be done. And then you can go to sleep. Or so if the doctor has split it up to be twice a day, take it first thing in the morning and then in the afternoon, take the other one. So it still gives you a fighting chance to get some sleep at night because you're not being woken up to go pee. So that would be one of the things, education pieces. A person who's having difficulty with high blood sugar levels related to diabetes, the caregiver would need to know what can cause the increase and change their diet accordingly. A lot of times it's just they just don't know. Um, like for instance, I've seen it. Well, I no, I don't give them any sugar, but they had an apple and an orange and a pear and not realizing that all these sugars in the fruit are just as bad at causing high blood sugar levels. And they're like, oh, I thought I was giving them nutritional food and this will be really good for them. Is what caused the spike, or carbohydrates, not realizing that piece of bread is going to cause their blood sugar to spike. So then you err on the side of teaching them about proteins and bringing the blood sugar levels down and keeping them a continuum. And then also talking to them that that would then trend to a weight loss if taking out these foods. And ultimately, because if you've lost weight, then chances are you're not going to be on such a high medication of for like insulin or anything like that. So it really is, because they go to the doctors and you're not listening per se, because you're in an environment that is all hustle and bustle and doctor's got 5 minutes to spend with you. um, your blood sugar's up. I got to increase and then that's you take that prescription to the pharmacy and you go home and that's all you know. So if you've got a skilled nurse coming into your home, you've got your listening ears on, and you can be educated at your much more time spent.
So really, while you're in the appointment, if you feel rushed through it and you feel like you're not ready for this, say it's a medication change like what you just talked about, would it be appropriate at that time then to say, I'm really not comfortable with this. Could you prescribe home health so that we can get some education on this?
Absolutely. Yeah, that'd be a perfect example.
Many people worry about the costs of home health. Can you explain how that is covered?
The medical industry and is forever changing, and along with the insurance benefits too. And it's most likely change from state to state. Typically, home health services are covered through Medicare if you meet the criteria with age, especially maybe with a disability. So it's usually through Medicare, Medicaid, and health insurances. But I don't assume just because the physicians ordered it that it's going to be covered. They always check and ask the agency that you're looking to signing on services with. The agency is the best place, as they're not going to provide services if they're not going to get covered, if it's not going to be covered by the insurance. And they would know if there's going to be a copay, how much that would be. So definitely don't assume that it's going to be free, but the agency, like I said, will help you with that for sure. Because they will look even before they sign on. They'd be like, let's look and see if they're covered, and then they can let you know.
There are so many home health agencies out there. What should you look for when you're choosing a home health agency? And are there any red flags or key questions that people should ask to ensure quality care?
Yeah, when choosing a home health agency, look for their certification by Medicare or Medicaid. Also, the range of services they offer. The more that you can get under that umbrella, the better for you. Additionally, consider the reputation in the community and any recommendations from healthcare professionals or previous clients. I wouldn't assume, and this is me personally, I wouldn't assume the choice from the hospital is the best one, as they have a tendency to partner with agencies. And so it doesn't necessarily mean that it's the best choice for you. So they always have their top three, or yeah, or just automatically refer you to a specific agency. That's the one you have to go with just because they've said it.
If the hospital refers you to an agency, it doesn't mean that you're absolutely stuck with that one. If you're
No.
Okay. I know that we went through a lot of home health agencies. We tried a lot of them. And I would say from my end that interviewing them ahead of time is a good idea. Maybe just Google some questions on what to ask for home health
Yeah.
that pertain to your specific situation because every situation is going to be different.
Yeah, that's not uncommon. I, as the RN for the agency, have been asked to go in and be interviewed by the family. They've usually said, no, we want to know who the nurse is and we want to see her. So I've gone in, nothing like pressure, because I'm literally being interviewed for a job. But they want to know who you are and what makes you the person for them. And it gives them a chance to, yeah, ahead of time without signing any dotted lines. So absolutely feel free to be able to do that because you can. It's available,
Yeah.
and I would highly recommend it because sometimes what you see in a nice flowery resume, on google.com doesn't necessarily mean that's what you're going to get.
And trust your instincts. Always trust your instincts. If you feel like this isn't the right fit,
Absolutely.
go with that.
Yeah, if you have a doubt, don't do it. Go on another one. And really ask around friends, neighbors, that they're your best bets rather than 5 stars on whatever it is that they do, Facebook or Google. Doesn't necessarily mean that they're great.
I'm wondering if you'd be willing to share a story about a patient that you saw where home health made a difference, and what's one thing you wish more people knew about the impact of home health?
So I really believe home health is a great benefit in the community. The hospitals have their place in assisting people in acute care of a crisis, but don't have the time, or people are not in the frame of mind for listening to education on what happened and what steps they needed to prevent the situation from happening again. They are usually given paperwork with general summary of their visit. In the home, a skilled person has the time and the patient is more calm with listening ears to learn about their physical bodies, and also the caregiver is too. Also, if there's a caregiver that's specific, then you can make the time to meet when that caregiver can be there. Sometimes if the person's coming from out of town because they find out that the family member needs help, but they're not there in the hospital, but they're now available in the home, that's when that person needs to listen, and the RN or the LPN could be there to help them, ask questions and provide education for them. The nurses come often get to know the patients and can see where the help is needed. So that's one of the benefits. And they can help organize the medications, teach about the effects and interactions. They teach easier ways for the patient to get around the home, like with the physical therapist and the occupational therapist. They teach them how to work smarter and not harder in conserving energy for both themselves and the caregiver. Learning about equipment that's currently available and resources in the community to assist acquiring the equipment. The social worker is a good resource to assist with what's available in the community. It's amazing what's out there and we don't know because it changes and evolves over time. It helps to have someone who knows the system, such as the Medicaid system. Social work is good for that. It can be overwhelming not knowing what paperwork you need before you make that phone call to make that application, that kind of thing. So, a couple of stories that I thought of, kind of made me smile when I was thinking about it. So use typically the VA will use this a lot, and it can be as simple, well, simple for us, but complicating for the patient. We call it a Mediset refill, and we basically go in and organize the medications and put them all in a Mediset for them, pill box. And we'll go in like every 2 weeks or something to that effect if there's been medication changes, that kind of thing. So you get to know, and they usually, I've seen it mostly men, and they live by themselves, and they're elderly. And so I always ask before I leave, is there anything else I can do for you? Because sometimes it's just like the odd thing that you can get, reach for, what have you. And this one particular guy, she's quite grumpy. And so I just kind of do my thing and ask if there's anything to, and leave. And he said, well, yes, there is. He says, could you check my dog's heart? And I'm like, what? And he's like, he looks like he's not been feeling well. And I'd really appreciate if you could check his heart. And I'm thinking, I don't even know where the dog's heart is. So I'm quickly Googling it because I didn't have the heart to say, no, I don't know what I'm doing. And I'm like Googling heart rate for a medium-sized dog. And I'm feeling around with my stethoscope, and I was like, oh, okay, I found it. So I'm taking his heart rate for a minute or so, and it's like, well, it seems to be doing fine right now. It's like, okay, that's good. I was like, just normally you get asked, can you fix the remote control on the TV? That's usually the number one things that you get asked. But anyway, I was like, that threw me for a loop because I've never been asked that before or since. And then there was one where he was in his 90s and really cute guy. And I came into his home one day and I thought, oh my gosh, it's really hot in here. And I could see that the fan was on, but I couldn't feel any air. And I realized that it was, going the wrong way, as in it was being sucked up instead of blowing down. Well, the only way you can switch that around is to literally go up on a ladder and make the switch on the actual fan itself. And so I told him, "Their fan needs to be switched and turned around." It's like, oh, okay. And he's off to get a ladder. And I'm going, oh my gosh, no, 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 it's not going to be good. So I said, let me go up the ladder for you and let me make the switch. And it's like, he says, well, okay, I'll hold the ladder. He says, and if you feel like you're going to fall, make sure you fall on me. Like, okay. So fortunately, it worked out. I didn't fall, and we got things changed around for him. But that was cute. That you get asked to do quite a few things. One of them was at Christmas time, the couple the Christmas tree was all the way across the way in the garage, and it was snowing and cold, and neither one could get it. And I just could not see Christmas without the Christmas tree. So I took it upon myself to go find it in the garage and haul it over and put it up for them so that they could have a Christmas with the decorations. And at the same house, I got asked to replace the air filter in their home for the AC and air, heating and air, because it's one of those, really big ones, and it was high up, and so you have to be careful where the lines are, but you also just have to know that you are it sometimes for that moment, and it's safer for you to do the job than it is for them to do it. But it just comes with the territory. I know I'm not the only nurse that's done become jack of all trades because of it. It's one of the things I enjoy, truly.
The benefit in that is that you're seeing them in their home environment. Their doctors aren't. So you're seeing things that are wrong in their home that maybe
Yeah.
nobody's ever going to see. And so
Mm-mm.
that gives peace of mind to the family members, to the loved ones of this person who needs help.
Yeah, no, it truly is like I was saying, they're with talked about blood sugar levels, and they're not realizing that the food that they've been eating for the last 20 years is actually causing them more harm than good. And then teaching them now there's alternatives these days, the last 10 years, 20 years, things have changed, so that you can place what they're usually taking. They're thinking a drink of orange juice is the best thing, and it's like, no, it's not. I'm sorry, but that's where your blood sugar just spiked, and now you gave yourself extra insulin, and next thing you know, you've crashed, and you're wondering why you're not feeling well, that kind of thing. So just education, but because you're in the home, you're seeing it, and both for the caregiver and the patient. So yeah, I agree. I enjoy it. Everybody has their niche. You get your nurse that's in the operating room, and that's her thing. Get them in the ER, and that's their thing. And get the labor and delivery, and we all look at each other going, "Oh my gosh, I don't know how you can do that." Well, fortunately, all different, and we all have our areas that we enjoy. So just happens to be mine.
Well, and you do such a good job at it. We always appreciated you when you were in our home and beyond.
And beyond. Thank you. I don't get that with everybody. Yeah, but it's nice when it does happen.
Well, there is so much to know about home health. We just kind of touched on some of the important questions, and I hope that this has been helpful to people. Thank you so much for joining me, Sharon, and I will see you another time.
Thank you, Ruth Ann. Appreciate it very much. It's a pleasure to be here.
Thanks for listening, and make sure you hit that subscribe button so you're notified when the next episode is available.